Welcome back. Blood cancer affects thousands of people every year, but it's a type of cancer many people aren't familiar with. This morning, we're telling you about a free forum that will educate you on blood cancer and explain the latest research and treatments available. And joining us this morning, Dr. Swami from the UT Health Science Center, Megan Blecker-Piercy, who is a cancer survivor, and Nicole Bell from the Texas Forum on Blood Cancer. Thank you all for being here this morning.
Thank you for having us.
I've not heard of blood cancer. I know it exists and it's out there, but it's one of those cancers that a lot of people might not know about. So tell me a little bit about blood cancer and where it comes from.
Blood cancer is a cancer of cells that normally exist in the blood and the bone marrow, and also in the lymph glands. And these are cells that typically help in various functions, including fighting against infection or carrying oxygen, or allowing us to prevent us from bleeding. But the mother cells which produce these cells may, for whatever reason, because of genetic damage from various sources, do go out of control, and instead of producing mature cells, these cells go out of control and then start proliferating and get into the blood and cause a lot of problems to the body. So that's, by definition, these are blood cancers.
Megan, you're a cancer survivor. Yes. How did you find out that you had blood cancer?
My original symptoms I chalked up as being stress. It wasn't until I woke up one morning with softball-sized bruises on my legs that brought me to my doctor. And my initial blood work came back clear. It was, it was negative of any type of cancer. But it was a tumor that was in my neck that my doctor went ahead and got biopsied that did show that I did have cancer. And at the time of my diagnosis, the tumor was 5 pounds on my chest, and it was going up into my neck and bending my trachea. And so, from there, she sent me immediately to an oncologist.
What are some of the other symptoms? Megan said she was feeling fatigued. What else should people look for?
People feel tired. People may have frequent infections. People may develop blotches of bleeding under the skin, or have nosebleeds, or even without any provocation have bleeding from the gums. So these are some of the symptoms.
And I know, Nicole, that you're trying to get the word out there about blood cancer. What do people not know? What should we know about this kind of cancer?
Well, I think it's important that people have the information so when they go to talk to their physicians, they can ask the right questions. So the Leukemia Lymphoma Society's goal is to put out as much information as possible about blood cancer so people have a good awareness. So when they go in to see a physician, they can ask the right questions.
And Megan, what kind of treatment did you undergo to combat this cancer?
I went under CHOP chemotherapy, which is an assortment of drugs, and I can't pronounce any of them, maybe one of them. First I went through the chemotherapy, and then I was randomized for a stem cell transplant where I used my own stem cells. And to prepare yourself for stem cell transplant, you go through high-dose radiation, high-dose chemo, where you can't even produce your own blood cells, your platelets. Basically, it clears out your system to prepare you to receive the new cells.
And what's your status right now?
I've been in remission for 10 years.
Okay. Very good. We're glad to hear that.
Thank
Congratulations. Is this a cancer that can come back once you have this type?
Potentially, yes. And I think what Megan has gone through was an attempt in a clinical study to make sure it doesn't come back. And it's a great success story.
Let's talk a little bit about the Texas Forum on Blood Cancer and what people can expect when they come out to the event.
It is on February 12th. We're going to start registration at about 7:30 in the morning. And we'll have a total of 3 keynote speakers, one talking about the acceleration of drug development that's being funded through Leukemia Lymphoma Society. We have Dan Shapiro, who is an author and 3-time survivor, coming in to do his story. And then there are 3 breakout sessions where families and patients and healthcare professionals can come out and listen to their disease-specific blood cancer. So if you have a lymphoma, you'll go to lymphoma. If you have a myeloma, you'll go to myeloma. Or if you don't have one of those specific diseases, then you would go listen to a general talk either on survivorship or exercise. And then we finally wrap up the day with Dr. Swami talking about personalized cancer medicine.
What would you say to our viewers this morning? I know we went through a cancer situation in my family recently, and I've found that there's so much unknown. Although we do know a lot about cancer, we don't know very much. You really have to be proactive. What would you tell people watching this morning who feel like there's something wrong? What should they tell their doctors?
Get it checked out, and if young adults with cancer, sometimes doctors don't listen, so you have to be proactive, know your symptoms, and question what they do, and have a positive attitude and outlook through the whole thing.
Absolutely, and certainly it's up to you to get the most up-to-date information that you can out there regarding cancer. So we want to invite you to the Texas Forum on Blood Cancer. It's at the UT Health Science Center. It is a free event, but there is limited seating. It's February 12th from 7 in the morning until 4. You can check out the website there, and of course you can give the phone number a call at 377-1775 for more information.